Hey guys, it's Dr. Ennis in Boca Raton, Florida. Today we're going to talk about an overview of the face, what happens to the face as it ages, why you're seeing the changes you see. There's some very predictable things that happen in the face, and we all age in the same way. It really just depends on where along the timeline we are. So if you understand what's happening, it's very easy to undo that process, fix the underlying things that are changing, fix the muscles and ligaments, and get a really nice natural look. So when we talk about the face, I always tell everybody we have lots of options. We have lots of tools in our tool chest. They all do different things. So we need to pick and choose the tools that apply to you. So at one end of the spectrum, there's all the Botox and fillers and lasers and chemical peels. Those things all address skin quality, but they're not going to do anything for structural problems. Surgery, on the other hand, is going to fix structural problems, but it's not going to fix the fine lines and the brown spots. So it takes a little bit of both to get an optimal result. But let's go through the surgical things today, and I'll show you a bunch of options and show you kind of what's happening and what's changing. So when we look at the face, there's several things we have to look at. One, you have to realize that gravity is working straight down. So everything we're going to do in the face is always geared at lifting up. Never, ever, ever want to pull this way because gravity doesn't work that way. We've got to lift everything back up. So as we talk about the face, again, we've got to fix the structural parts. So we're going to divide the face into three parts as we talk about it. There's the brow and the upper eyelids. The middle third is the lower lids and the cheek pads. The bottom third is the neck and jawline. So when we talk about a facelift, we're really just talking about the bottom third here. A lot of people think a facelift does the whole thing, but it really just addresses the bottom part. So as we look at each part, when we look at the top third of the face here, the question is, we look at the brow position. So I give people the analogy about a curtain rod on a window. If you take the curtain rod and you lower it halfway down the window, the drapes are going to puddle at the bottom of the window. Question is, do you raise the curtain rod? Do you trim the drapes? Well, in most women, you're better off raising the curtain rod back to the top of the window before you trim the drapes, or in essence, do a brow lift before you do an upper lid. So in this lady, her brow sits nicely above the bone here. You want the brow to sit about a finger breadth above the bone. You want the peak of the brow about 2/3 of the way out. When that happened, it looks very nice. It doesn't look surprised. So as the brow's dropping, it's dropping like this. It doesn't drop in the middle. So if the brow's dropping on the sides and you pull in the middle, it looks very surprised. So anytime we're doing a brow lift, we simply lift on the sides. Never ever want to pull in the middle again because it gives you a very surprised look. So that's all done endoscopically, 4 little incisions up in the hairline. Next is the middle third. So what's happening in the middle third is there's 3 little fat pads that sit here, and there's a curtain of muscle that hangs in front of the lid. As we get older, the fat gets heavier and the muscle gets tired. So over time, that muscle begins to fall forward and we get the puffiness under our eyes. But the second thing that's happening is what we call the malar fat pad is descending, or this cheek pad right here. This cheek pad drops down. As it drops away from the eye, it leaves you with some hollowness here, which makes the puffiness worse, and this line begins to get deeper. So anytime we're fixing the middle third in somebody who's got some puffiness, we do a lower blepharoplasty. That's done through a little incision underneath the eyelashes, take out the fat, tighten the muscle, and most importantly, lift this cheek pad back up to fill this groove in and fix this line so that you can see our eyes look much more rested. Now, there are a few people that don't have the puffiness under their eyes. This can be achieved the same way endoscopically by making a small incision over in the hairline, looking in there with a camera, and very gently lifting this cheek pad endoscopically. That procedure is used for somebody who doesn't have the puffiness and doesn't need their lower lids done. Now, in the bottom third, there's several other things going on, and you have to understand, again, that it's a muscle and ligament problem, not a skin problem. So if we go back and look at the history of facelifts, way back 1980s, 1990s, the old facelifts were a skin-only facelift where the skin was pulled really tight like this. Unfortunately, the muscles weren't corrected, so when they pulled the skin tight, the skin's very elastic and would stretch back out. So every 5 or 6 years, the ladies would go back and pull it up again. By the time they were 60 or 65, they all had stripes on their face going this way. Gravity doesn't work this way, so pulling this way didn't help. If gravity's working down, we've got to lift everything back up. So mid-2000s, plastic surgeons started getting smart and said, you know what, we need to fix the ligaments in the face. So there's a big ligament in the face called the SMAS, S-M-A-S, stands for superficial musculoaponeurotic system. This is the ligament that all the muscles are attached to. And what we would do is we would go and we'd lift this ligament from back here. It did a phenomenal job of fixing the jawline. It did almost nothing for this heaviness up here. So as we advance the procedures, we now do a deep plane facelift where we go underneath this mass and we lift these little tiny muscles muscles from up here. And as you can see in this patient, it's nicely fixed to both the jawline and the nasolabial folds and marionette lines. So that's the deep plane facelift. Now, people sometimes confuse that with a ponytail lift. So what's a ponytail lift? A ponytail lift really just is referencing the incision or the shape of the incision. So the old style facelift incisions would come across the back right here. So if you put your hair in the ponytail, you'd see it. So the ponytail lift or the ponytail incision is taken back up high behind the ear so that you don't see it. You can easily put your hair up in a ponytail or go swimming and there's no scar that's visible there. Now, the last part is the buccal fat pads and the lip lift, which we'll address in the next video. But as long as you understand that it's a muscle and ligament problem, that when we fix the muscle and the ligament, it looks very nice. Second, gravity's working down, we're going to lift everything back up. That's how you get that really nice natural look.